I think it's important to spend a few minutes reviewing the information that was provided. The information provided by Debbie about her daughter, Holly, was extraordinarily rich with data, essentially, that we will use as part of our CVI range score. CVI is best identified through three elements. First of all, an eye exam that does not explain the way the child uses their vision, a history of a neurologic condition that is associated with CVI, and the presence of the unique visual and behavioral characteristics. Most of this information was actually provided in the interview. It is clear that this information must be followed up with direct assessment and observation elements. But in terms of the interview, let's kind of review some of the rich information that was provided. So the eye exam. Debbie reports that Holly's eye exam was actually positive for some important findings. First of all, she described her daughter's having nystagmus, or that, random movement of the eyes. She also described the strabismus, that her eyes turned inward, actually both eyes turned in, and that she had surgery for strabismus. Both of these conditions are actually neurologically based conditions. And in addition to that, she described the fact that her daughter has glasses for farsightedness. So these pieces of information in and of themselves do not explain why Holly seems to only view things that are just inches away from her face, why she has difficulty with novel materials, and so forth. The second element is a history of a neurologic condition. Debbie explained that her daughter was 33 weeks gestation, but as we all know, prematurity is not in and of itself a cause of CVI. However, prematurity can kind of set you up to have some difficulties. Debbie mentioned that once Holly had an MRI, that PVL was identified. PVL is, of course, a condition associated with CVI. It is a condition in which there is damage to the white matter, and it is a very distinct and relatively common cause of CVI. And third, Debbie provided some important information regarding the 10 visual and behavioral characteristics. So we'll briefly go through those. First, in terms of color. In our interview, Debbie discussed how Holly seems to be attracted to things that have bright colors. At first she mentioned that orange may be her preferred color, but then she kind of also described how other bright colors were important. Because there were a variety of colors that were described, like pink and red and blue and possibly bright green being a little more important than blue, that suggests to me that there isn't at this time a particular preferred color, but rather an attraction to color that is vibrant. And I think that Debbie used the word bright, and that is an important finding that tells us that color does in fact help draw and hold her attention. She also made the comment that gray makes me nervous, that her daughter says gray makes me nervous. And I think that was actually a pretty interesting comment, and one that may suggest that when there is an absence of distinct color, that perhaps Holly gets a little disoriented or has a more difficult time kind of figuring out what she's looking for. The second characteristic we'll discuss is movement. We did not get a very rich bank of information regarding movement, and so obviously we're going to have to follow up with observation and direct assessment. However, Debbie did describe her daughter as using her peripheral vision primarily. That, for example, she mentioned that her daughter seems to look past her rather than right at her. Those are signs that Holly is not using necessarily direct fixation, but relying more on that dorsal stream of vision, which is, of course, regulated by movement. More information is clearly necessary. Visual latency. I did prompt Debbie to actually set up a kind of a question about whether it took more time for Holly to notice things than she might expect. What we did hear about was that many times the family members, including Debbie, will actually give something to Holly. They actually present something in her hand, near her hand, and that they feel they have become so in touch with what Holly wants that they can anticipate that. I'm not sure if that's related to latency. Obviously, we're going to follow that up with observation and direct assessment, but an important piece of information from her mom. Visual fields is the fourth characteristic. There was a lot of information provided in terms of visual field function. That Holly is described as a person who is using a cane. When I asked, why does she have a cane, her mom described how Holly has difficulty with drop-offs, with stairs, with curbs, and so forth. That her lower visual field is probably affected. This is a very common finding in children who have white matter damage. Excuse me. She also mentioned that she uses a slant board, which would help accommodate for her lower field, and that actually, interestingly, Holly herself positions her materials more to her left side. When asked directly, her mother did report that, yes, it seems as though she kind of uses her left visual field more. At one time, Debbie mentioned that Holly may have some difficulty shifting her gaze upward as well, and that twice she was actually injured. And I felt this could be related to lower visual field or other visual field dysfunction. The need to do a modified confrontation technique and to do more observation of how Holly actually negotiates novel space is critical to finish out that portion of the CVI range. The fifth characteristic addresses the area of visual complexity. As you know, complexity has four distinct sections, four areas that are investigated. We look at how complex should the surface of the object be, the complexity of the array, the complexity of the sensory environment, and the complexity of human faces. In terms of the object, it was interesting because we couldn't get very much information about objects at all. That it appears as though Holly's interest is not so much centered on objects, and that her mother reports that there are some objects that she is with which she's familiar, but otherwise she may have difficulty kind of figuring out what an object is. We have to take a look at that and see whether her difficulty with objects could have something to do with the number of colors and patterns on the object. My impression, my impulse is to consider reducing the complexity of the surface of the object and to make sure that we begin to teach salient features so that Holly can begin to look at a target and analyze it based on not just her familiarity with it, but what the object actually looks like. We also got information about the array. We got quite a bit of information about complexity of array, actually. Debbie mentioned that when her daughter looks at dolls on a shelf, that she doesn't really know what she's looking at, that there's just too much information. But when asked, well, what does she do when one doll is offered to her, and her mother reported that she knows it's a doll. She also mentioned that in order to help Holly use a picture in a book or even words on a page, she uses a window card, that she cuts a window out of a card and moves that along to help Holly find the pertinent information and to help suppress or eliminate the background array that may be overly complex. Debbie also mentioned that Holly has some difficulty in new environments, and that also could dovetail with complexity of the array. The third part of complexity is the sensory environment. We will have to observe and do some direct assessment to see whether Holly can continue to maintain attention on a target when there is additional auditory, tactile, even olfactory information present. Interestingly, Debbie mentioned that her daughter does rely heavily on her other senses, and it could be that she is unable to pair vision with other senses. And finally, the fourth aspect of complexity deals with the complexity of the human face. And I think we all probably heard that Holly is not really able to discriminate faces, that she looks past faces, that she relies on the touch of someone's face or even their hair to help confirm. She also mentioned that she uses situations and voice in order to kind of put together the puzzle of the face and the individual that belongs to that face. The sixth characteristic is light gazing. Clearly there is indication that Holly has a greater need for light than other children her age. That the very first object she looked at had lighted aspects. That when Holly goes into a room, her mother reported actually off camera, that when she enters a room, the very first thing she looks at is the light in the room. That light continues to remain an important factor. It would be interesting to see if Holly has improved visual function with something that has backlighting, like a tablet device or even a computer screen. The seventh characteristic is distance viewing, and we got some very clear information there, that Holly tends to look at targets within 8 to 10 inches from the target. That even when she gets in front of the 47-inch TV, that she gets within inches of it. Again, that when she is in new places, that she tends to stay very close to her family members because she is unable to negotiate the information at the distance. The eighth characteristic are reflexes, and we are unable to get information about that characteristic unless we do a direct assessment of the blink and the threat. We can sometimes observe some things related to the reflexes as well, but we did not gather that information in the interview. The ninth characteristic is novelty. Children with CVI have a kind of reverse visual novelty response. And unlike their non-CVI peers, children with CVI tend to show much more interest, much greater visual attention on targets with which they are familiar. Debbie mentioned that a couple things that were important, that her daughter loves to be at home, that new places can be confusing. She moves closer to familiar people, and after a period of time, she really requests or desires to go back home. That when something new or something familiar are offered to Holly, that Holly will very consistently prefer the familiar object. Some of these objects, her mother mentioned a toy that goes all the way back to when Holly was a baby. Novelty is clearly a characteristic affecting Holly, and one that we got interview information about. And the last characteristic is visual motor. Now, this is one that will clearly require observation and direct assessment, but we did get some information that Holly at times overreaches, underreaches, misses the target when she is attempting a fine motor task. Now, the key for the characteristic is one in which a child with CVI looks toward the target, glances away, and then reaches without looking. Again, we got some hints about this, but we'll have to confirm this with observation and direct assessment. I do want to mention that there was some additional information offered about some visual spatial difficulties, like having difficulty locating the home keys on a keyboard, or difficulty with handwriting tasks. These may or may not be related to the visual motor characteristic, which is very distinct in its definition. Obviously, these are things that will require adaptation or support. So in review, we did get information that really helps confirm that that Holly is a child with CVI. She meets the criteria in terms of the 3 diagnostic criteria, and we are beginning to get a really distinct portrait of how these characteristics are manifesting. Again, you have not completed the CVI range if you do not do interview, and even more importantly, you've missed an opportunity to get some really helpful and enriching information.